Hello, everybody, and welcome to the webinar. Thank you so much for coming. First of all, I'm Alex van Tulleken. I'm an associate professor, honorary associate professor at UCL in health of the public. And my background is medicine, public health, tropical medicine, and particularly humanitarian crises. And I'm absolutely thrilled that we're doing this. And the reason we're having this webinar really is in the service of the new master's degree in humanitarian policy and practice. And so I wanted to kick off. In fact, of all the speakers, I have the least experience overall, but I also have no particular experience in Ukraine. I've worked in a handful of humanitarian contexts as a medical coordinator and as a doctor, particularly in Sudan. And so my real interest in the teaching that I do, in the writing that I've done, and increasingly in aid work that I've been involved in and in broadcasting, is to try and get the humanitarians of the future and the current humanitarians of the present to avoid the pitfalls that I fell into as a doctor embarking on humanitarian missions with limited understanding of the humanitarian context, the legal issues, and so on. And so I think our speakers are going to speak brilliantly about the details of Ukraine, but I just wanted to sort of frame the issues as you might see them as a master's student. The situation in humanitarian crises is always one of overwhelming need, and we see that nowhere better than in Ukraine, where we have more than 20 million people in need of assistance, more than 4 million people around Europe in country. Probably over a third of Ukrainians are in need of some kind of humanitarian assistance, and the difficulties of accessing them. There is a legal framework to get to them, the Geneva Conventions, international humanitarian law, and yet, of course, the warring parties, it is for all kinds of reasons very difficult to access the people who most need help. When you get there, the help they need is complex. And I don't just mean things like the provision of technical goods and services. It's hard to run a hospital. It is hard to run a sanitation system because you are necessarily replacing the government in a humanitarian crisis. We talk about non-governmental organizations, but in fact, humanitarian organizations are very governmental. They do public health. They do things that the state can't do because the nature of the humanitarian crisis is that the state can't cope. The local and regional actors are struggling to cope. But you also have international issues, the cascade of problems, both political and humanitarian around the world, the effects of this crisis on other crises, and the consequences of things like energy prices on different people around the world, creating further humanitarian crises. So things like grain export legislation and possibility may be a far more important consideration for you as a medical coordinator than, in fact, the immediate, or as the immediate patients in front of you. So the master's degree is an unbelievable way into this kind of scope of thought processes. And I'm hoping that you will get a flavor of that. I'm very, very happy to talk about those humanitarian issues more generally, but now we're going to hear from each of our speakers in turn. They're going to do a quick hit, 5 minutes each, and then we will have time for everybody's questions. So I'm thrilled to introduce really someone who's incredibly important in my career in humanitarian aid and my life in general, my friend and colleague, Maria Kett, who is a wonderful human and very gently guided to me towards all kinds of important things that I might need to know and read before I next headed out on a medical mission. So I'm very grateful to her. I've taught with her for many years, and she is the director of the new MSc. So without further ado, Maria, do you want to kick us off?
Brilliant. Thanks, Alex. And thanks everyone for joining us. I'm really pleased to be here. It's a really important event. You know, we mark 1 year since the start of the war in Ukraine. And I think this is, you know, a lot of the stuff you've touched upon, Alex. You know, we know there are, you know, I feel like there's books written with titles called, you know, Condemned to Repeat, or, you know, Lessons Learned. There are endless books about this, and it does feel like we often ask that question, right? And so this is where I think we're coming from. Like you know, I've been to many humanitarian conflicts and contexts, and I think you know, do see a lot of the same issues arising. Colleagues writing in the Lancet recently, to commemorate 1 year since the start of the war in Ukraine, really talked about this need to shift from the emergency phase now into a longer term response phase, and really talking about the challenges you've touched upon, Alex, the health challenges, but much wider challenges around, shifting demographics in society, and, really thinking about, policies that were begun to start before the conflict, the health policies and other policies that were being developed, but weren't being able to put in practice because of the conflict, but now perhaps need to start shifting towards that, and adapting to those changes in society. The numbers of people that have gone out to fled to other countries. What does that mean for the health system in the country? What does it mean in terms of who's left behind? And I think really understanding these approaches and understanding these new norms and realities is a real. The nuances cannot be underestimated, and really trying to understand and explore those in a perhaps a safe space, to call it, is really important. And that's what we hope that learning on a program like the MSc Humanitarian Policy and Practice will be able to generate for students. We want to have, give people the tools to unpack these questions. As I said, it's very hackneyed. What lessons have we learned? And it's very easy to say. It doesn't seem like we have learned lessons. How do we shift these discourses? How do we move them on from what they currently are? And my research, a lot of my work has focused on humanitarian assistance for people with disabilities. There's a whole raft of tools and guidelines out there, many of which I've contributed to. But as we'll hear from Anna, I think, a year on, who were, some of the most excluded and left out in the response in Ukraine, and why, why, when we have all these resources and guidelines, do we still have this same question? Sometimes it's a really mundane, I have heard about people being trapped in cars because they don't have a walking stick or a walker to get out of their car. That might sound really trite, but it means you can't flee, you can't queue for your bread rations, you can't, you don't have access to things that everybody else does. And these are really, important issues to think about. I'm currently working with the Global Disability Innovation Hub to support the WHO's work, looking at the support and delivery of assistive technology in humanitarian contexts. And I think this, assistive technology rehabilitation haven't necessarily been really hot topics in humanitarian context, and for lots of different reasons. When we talk about medicine, it's often the emergency, whizzy, the sort of immediate things that people think about, much less the longer term implications. And I'm sure we'll hear from Elias about some of those emergency, responses, etc. But it's really important to think about the longer term, and I think that's really key. Maybe where we need to learn the lessons is in those longer term changes, rather than always thinking it's it's always chaotic and it's always huge numbers of people fleeing and lots of happening at the beginning. But what happens in the longer term? And I remember the first time I ever went to Bosnia many years ago, the very people left behind many years after the end of the conflict were the older people with disabilities, and having the same conversations. And that what do we need to do to change those conversations and shift the discourse? There's lots of stuff going on. It'd be great to see it being put into practice a little bit more. So what do we need to do to get that to happen? Yeah, I think that's my 5 minutes. I'm going to stop there, Alex, and hand it over to the next person.
Oh, and leading by example on the timing. So thank you very much, Maria. Our next speaker is Yulia Ioffe, who is an assistant professor at UCL's Institute of Risk and Disaster Reduction. And she has a PhD in law from the University of Oxford. She's an expert in child asylum law. She's a Ukrainian human as well, with particular insights into this conflict. So Yulia, we are thrilled to have you here. Thank you so much for joining us. Away you go.
Thank you so much for the kind introduction and generally for inviting me to this esteemed panel. Also by way of introduction in some of the points that I will touch upon in terms of challenges and potential lessons that we've learned from this second wave of Russian aggression in Ukraine. Just to know that I used to work for Ukrainian Red Cross and UNHCR in Ukraine, but I also have experience in other countries, including similarly to Maria in Bosnia and Herzegovina, and I work mostly with refugees. So I worked with Syrian, Iraqi, Ethiopian, Eritrean refugees, so refugees from around the world. So I think the point that was already made is that some of the things in Ukraine are not unique at all. And unfortunately, some of the lessons lessons, unfortunately, we haven't learned from previous crises. And in this particular war that started a year ago, I was involved on a volunteer basis because of my personal circumstances. I was teaching here at UCL, but most of my family are medical doctors, and my father is a head of surgery in one of Kiev hospitals. So I started volunteering and collecting just lists of medications that they needed for treatment of wounded in Kiev and Chernihiv Oblast. So for a couple of months, 2 or 3 months in the beginning of the war, there really seemed to be a gap in humanitarian response, especially from international organizations and international NGOs. And a lot of work was done by just Ukrainian volunteers or Ukrainians abroad, or obviously citizens of other countries who were incredibly supportive. And obviously, again, I would like to highlight, and am very grateful as all Ukrainians, in terms of the solidarity and all the help that was provided, not just by international organizations, but just on a grassroots level. I think we haven't seen such support for a long time in humanitarian crisis, but also just based on that, to highlight some of the challenges. So one of them is I was a bit shocked in terms of lack of preparation by the international organizations and some of the NGOs, and especially considering that the war in Ukraine is not new, it started in 2014. So the lack of preparation and some really trivial things like not having even web pages or links for donations specifically for Ukraine for the couple of first days or for weeks where the most of the nations are provided. That was a bit shocking to me, but obviously this is the question of resilience and preparation that is discussed in either crisis as well. And I think there is an agreement that we should do better with regard to that. And another point, which I'm sure is also discussed within this master program and which is discussed at UCL quite a lot in terms of humanitarian aid, is decolonization of humanitarian aid in terms of just listening to people on the ground, to local people, but also in terms of the structure of international organization, in terms of the divide between international and national staff. There was a lot of, there were a lot of negative feelings from Ukrainian population, because it did seem that at least in the first months of war, a lot of international personnel just evacuated to Poland and other countries. And even local people were evacuated to the west of Ukraine, where they didn't have direct access to the government and couldn't sort of negotiate some of the things that were necessary. So obviously these things, we've been thinking about them a lot. And I think it's obvious, similar as with Syrian crisis, that a lot of grassroots organizations, local organizations that have local knowledge of the language, of the culture, of the history, I think they have to have more voice, and there should be some kind of way to also prioritize donations and financial support to those organizations, and not just the big famous international ones. I think my 5 minutes are up, but these are my points. Thank you.
Yulia, thanks so much. And you've kind of painted a picture there of even with the level of maybe readiness and preparedness that we might have expected, bearing in mind the possible predictability of this crisis, that still the readiness, even in organizations that should have a huge institutional memory, is often wanting. And the closer you are to a crisis, the more you see the gaps in the response. Elias Pavlopoulos is our next speaker, and is a bioethicist, and I think is gonna be able to speak to really quite a few of these issues. He has experience working with MSF, Partners in Health, some of the leading international humanitarian organizations in the world, medical humanitarian organizations in the world, and is currently the team leader for UK Med. So Elias, we are thrilled to have you with us with all your experience. Take it away.
Thank you, Alex. Hello, everybody. It's happy to be here and support also this new master on humanitarian policy and practice. And I can say that the last 1 year I spent in Ukraine. It started last March. These days, I think we are moving, to enter Ukraine and to move from the west to the east to make an assessment needs. And I remember visiting different hospitals, and some of them were quite new. This period, I didn't know the famous reform that have started in health, the health reform that started in Ukraine in 2017. So I was impressed. I was thinking that someone attacked Germany, I will say, okay, so seeing all these nice hospitals around the country. Little by little, entering the system, we realized that we have a lot of problems. And I will say that we focus in two areas. One, inside the hospitals, in the surgical wards, okay, to support the surgical teams, and with the IDPs, internal displaced people, mobile clinics. I can say that inside the hospitals was very interesting, the situation, because the reform have never finished because of the pandemic, and because after that arrived the war. Okay, so let's say these reforms stay in the middle. And in this way, we had side by side an ex-Soviet style ward with a modern ward in a surgical department. You can understand the let's say the infections in this situation. You can understand the big differences inside the health system that was struggling with the overload that had, especially in the area of wounded people in Ukraine. We put some excellent surgeons from UK. We bring specialists in plastic reconstructive surgery, and basically these people, they have very competent people, but they don't have plastic surgery. They didn't have in the past. They didn't know, I will say, the more let's say details about how to deal with war trauma. It's a special trauma, the war trauma. Okay, so and in this way we train them in this thing. I can say that I was impressed in the way that improved the situation during months. At the beginning, I remember from the front line, they sent us people that they had really was really bad the way that they were treated in the front line. 6 months later, I would say, I remember around September, October, we saw that the trauma was more taken care well in the front line. The people have started learning about treating better the people in the front line, and after that send them in the hospitals, okay, for further care, etc. And I remember that they have set up an amazing project that called Unbroken, and this is the project for rehabilitation of all the people that they have lost a limb or a hand or something in the conflict. And in this way, I will say that we supported them in different levels, okay, so with surgeons, with physiotherapists, etc. So and I was really impressed because we have really young people, very dynamic in the different departments of health in the city of Lviv that I work mostly, or in the city of Dnipro, etc. Okay, so that they were really strong in wanting to make the change and wanting to make something different for their people. Okay, so and I can say that we continue to work, and we think that they will set up some really good strategies about rehabilitation centers in the next years are coming. Okay, so and I can say that another point that I want to mention, because speaking about the colonization of humanitarian aid before, I can say that Ukraine is a country that is let's say, is by example, we can, let's say, support and improve the capacities of and put in high-level positions national colleagues. We had people that they had a very good experience, so let's say very fast field managers become, let's say, national colleagues. Okay, so and I will say that in different levels of our mission, there are national colleagues very, very experienced with amazing and humanitarian experience, and also experience in their country. So let's say they are ideal to work in the different levels in humanitarian organizations. And I'm very sure as UK Med soon will have a head of mission that will be Ukrainian. Okay, so let's say that, and will lead the whole intervention in the country. That's my 5 minutes, I will say.
Thank you, Elias, so much. And you, between you and Yulia, you raise some of the most essential questions. So for the people watching this, considering the masters, this is a crisis that you will end up working in if you go into humanitarian aid. This is not, this is going to be a protracted set of humanitarian needs for a very long time. And between Elias and Yulia, you have a lovely, a very essential example of the roles of Ukrainian expatriates, Ukrainian national staff, other expatriates in Ukraine, the ways in which not just you deliver services, but the complexity of training people up, the delicacy of arriving in someone else's hospital and saying, we're going to work here now, and actually we know more about this than you in this particular way, but of course you know more than us in a huge, vast general way. And how do we empower people? Elias used the word colonization, such an extraordinarily important topic. So thank you both for setting us up so well. I'm going to move on to Phil Duloy, who bills himself as an independent humanitarian consultant. He has vast experience around the world, former United Nations staff and former Red Cross, and is going to kind of speak to the other aspects of the situation. Phil, I'll let you take over. Thank you.
Thanks so much, Xand, and for having me at this lovely panel of great folks. I'm going to probably look at this from a slightly more zoomed out perspective. I've spent much of the last year supporting a donor government in their response on various small aspects of what is a real sort of whole of government whose attention that Ukraine has so rightfully captured. And I would just say that, you know, for a crisis that's happening in Europe, you'd sort of think that there would be greater opportunity for the humanitarian sector as a whole to enact some of the principles that it claims to hold dear. And regrettably, I don't think that that's what we're seeing. There's a whole lot of desire to see localization, and yet the smaller sort of community service organizations that I was meeting with last week were saying that it's still extraordinarily difficult to access the funds, and these funds are meant to be cascaded to them. Sometimes there's more direct route than others. But what we're really seeing is that instead of being capacitated, they're being decapitated, where staff who are doing great work know the needs and know how to work within the systems and the means of delivery. They're finding that they just don't have the money to carry on, and they're being offered, you know, relatively exorbitant salaries to go elsewhere where they can have a greater impact. So who can really blame them for leaving? But the problem is that we're seeing poaching from Ukrainian organizations to the internationals. And I do worry that if we can't get this right and capacitate organizations in Eastern Europe, you know, are we going to get it right anywhere else? Equally, you know, we're seeing the private sector stepping up in a really great way, but we're also seeing huge risks. And I expect some people will remember that we saw a number of very good op-eds about the risks of trafficking and sexual exploitation and abuse associated with refugee housing models. And while a lot of people are trying to do some great innovative things, we as a humanitarian sector have not engaged in a meaningful, effective enough way to bring them along with us. There's a number of other themes, but I realize I'm out of time. I'd love to talk all day, and hope that you'll join the masters, and so we can have further discussions. Xand, back to you. Thanks so much.
Phil, thank you so much. And just to say, I hope everyone has the link for questions, but do take advantage of this group of panel and we've got some questions in. Send us all you can, and we will try and blitz through them, because you know, these are the central issues. And Phil, you rightly touch on this sort of you know, if it would be very good to ask Phil and the other panelists more about why we don't make it easier for small local organizations to be empowered, access funds, and for local capacity to be built. Someone's already posed a question about neocolonialism, which is exactly the kind of question that we should be posing of these crises. So we'll leave questions till the end, but do get them coming in. Our next speaker is, hang on a second, is Anna Landry, who is a researcher and activist in disability justice, focusing on disability and inclusive humanitarianism. I believe the stat from UNHCR is that 15% of the displaced people in this crisis are disabled as that, and that may even be an underestimate. So this is a vastly neglected and massively important topic, which Maria's and Yulia have already touched on. But yeah, take it away, Anna.
Thank you, Xand. And I'll start with that stat that you just shared. I think.
Sorry to steal your statistics. Sorry.
No, that's fantastic. I wasn't going to share it, but I think it is a good place to start. 15% is obviously a huge number, a huge portion of people. And as you said, it is an underestimation, because we know that in humanitarian crises, in wars, where the main kind of activity is to maim or to kill, disabled people are not only existing as they have for years, but being produced and becoming more plentiful. So it's a really important part of these responses. And where I come in to humanitarian work is I work for the Partnership for Inclusive Disaster Strategies, which is a disability-led disaster response organization. So all of our staff is disabled, and we seek to fill the gap in inclusive disaster response, where disabled people usually get left behind, are usually thought of as, well, those people just aren't going to make it, so we're not even going to try. And that results in a lot of really unnecessary suffering and death. And unfortunately, that was the case in Ukraine. I think a lot of people have shared how in a context like Eastern Europe, that's kind of just on our front doorstep, in a more developed infrastructure context, we didn't expect things to be quite as dire as they are. And with the sort of standards that Maria and others have made with respect to disability and humanitarianism, it really is frustrating that things are as they are, because we have a plethora of guidance documents and standards about how disabled people have an equal right to rescue, have an equal right to aid. But unfortunately, what we saw was that mainstream organizations in Ukraine were not sort of providing that as they should have, and disabled people were getting left behind. So what my organization did was we partnered with a disability-led Ukrainian organization on the ground based in Kyiv. And they're called Fight for Right. They're the most amazing group of people, a woman-led, disability-led organization. And where they had formerly only done rights-based advocacy, they turned around and said, well, actually what our people need now is evacuation and aid. And so we're going to do what we can to provide that. And we came in to try and help in whatever capacity we could, taking their lead, because they know the context. They know the types of disabilities and disabled people that are in Ukraine, the types of needs, and then we can help with the kind of disaster-related guidance. And so that's what we did, and we've been really successful and helped over 10,000 people with disabilities and their loved ones. A lot of that help is evacuation, because, you know, disabled people can't always stay in shelter in place and stand their ground in the same way that others can. When the electricity goes out and you have a ventilator, you can't stay, you've got to go. When there's shelling and you can't get into a bomb shelter because you're a wheelchair user and there are stairs, that's a different kind of risk and a different kind of decision making that we really were not seeing most organizations take into account. These were, you know, I'm not going to name names, but just the biggest humanitarian names in the field who didn't have accessible vehicles, so they couldn't move wheelchair users. There were gaps, you know, as frustrating and huge as that. So we have a lot to think about with respect to the guidance that we're writing and how we're actually implementing that in an emergency. Are we just writing things and shoving them in a drawer and clapping ourselves on the back? Or are we actually then putting it into practice? And I think as I've kind of tried to indicate, it's really important to center the people who are most affected, to center Ukrainians, to center disabled people, and not just serving them, but letting them lead. And that's what we try to do. I come at my work as a wheelchair user who could be caught up in any disaster. And so thinking about that and trying to honor those who are most affected. So I think that's my 5 minutes, and I will let us move on.
You're all brilliant. Thank you so much for running to time. I don't think I've ever had a panel. I don't know what I said to you beforehand that made everyone so terrified of the clock, but I'm glad it worked. So we do have time for questions now. I'm gonna kind of filter them through. We have there's a couple of questions that I think are really interesting. Is humanitarianism intervention neocolonialism, and are there any specific reasons about preparedness being lacking in the response? What were the obstacles to blame? Can we start with this, with the neo-colonialism question, because it speaks perhaps, Anna, if I can come to you first of all, it speaks to some of the issues that everyone has touched on in different ways. Outsiders, helping distant strangers is the nature of humanitarianism, and you are at the sort of intersection between the delivery of very complex, specific technical goods and services to help a group of people with very particular needs, combined with a much more theoretical question about going, well, how do we end up privileging certain groups over others? Why are certain groups neglected? If you're a student, you're heading into this master's, you want to, I think often students just go, give me the skills, give me the training, let me get out there and help somebody. How would you say to approach that, that question, first of all?
Yeah, this is a great question. And it's a question that we in the disability community talk about all the time, because even I, as a wheelchair user, have no idea what daily life is for a deaf person, for an autistic person. It's such a diverse group that is lumped together, for better or worse. And my advice is always to know what you don't know. You are never going to have all the answers. You are never going to be able to know what to do in every situation, but you want to surround yourself with people who do. So you want to surround yourself with people who are subject matter expert in disability, in Ukraine. And those should be disabled people and Ukrainians, because they have the lived experience. They know it like the back of their hand. And in, I think, particularly in these contexts, my organization, we just aren't able to go in when we don't have an anchoring local organization, because you don't know the context. You don't know what people need. How do you even find the disabled people who need help? So I call them our anchor DPOs. DPO means Disabled Persons Organization. So once a crisis occurs, our first step is to go find an anchor DPO that's willing to work with us and willing to take on this role, and have us help to capacitate them, but kind of take their lead. And yeah, so I think it's really important to be humble in knowing that you might be an expert in some ways, but you're never going to know everything.
Fantastic. Humility, that humility and lived experience. I feel like this is a rare master's where lived experience is the kind of the bedrock foundation that you will need. That you just, there's some things you can't get from a book. I want to come to everyone in turn. Can I go from Yulia to Phil to Elias? And then to Maria. Yulia, this neocolonialism comes up a lot because humanitarian actors deploy vast resources through, multiple African civil wars and displacement crisis in countries that had recently sought independence, and spend a lot of money, and aid becomes a magnet for displacement. All the kind of complexity of delivering aid through the 1990s and 2000s in sub-Saharan Africa has given us a big body of thought about neocolonialism. Ukraine feels like it should be different, and yet you've touched on that, the kind of the delicacy of the relationship. So did Elias, so did Phil. So can we start with you, and what a master's student going into this course, how they might think about that, and what you would say is essential knowledge about helping distant strangers, and also working with Ukrainian populations in and outside of Ukraine.
Thank you. Again, I don't think there are easy answers. And as you mentioned, decolonization, neocolonialism, I think these are all topics that have been addressed in certain ways in humanitarian action and generally in academic work as well. But I think at least with, and I'm coming to this as a lawyer, an international lawyer who I do research in refugee law and international law with regard to Ukraine. And I think a lot of issues are related to some of the gaps in knowledge that we have about Russian colonialism. So I think we also need to think about different imperial states, because I think, again, it's just more perhaps an academic discussion, but in a lot of literature, in Eastern European studies and in international law, when we talk about decolonization, we always think about the UK and the US as colonizers, but I think Russia and potentially China and other states are a little bit overlooked in this discourse. So I think a lot of that sort of misconception of Ukraine and Eastern Europe, and under, at least in academic knowledge, sort of for a long time, this area was overlooked. There was a lot of focus on Western Europe, and Eastern Europe always was lumped into this sort of together with Europe, but obviously there are certain differences, and Ukraine, as many other countries, are victims of Russian colonialism. And I think, again, things are changing in scholarship, but also in thinking about humanitarian action and how to deal with it, because obviously it also, understanding of this broader concepts, I think it informs humanitarian action as well. So I think now there's a lot of interesting research on mental health and how Ukrainians experience the war and mental health. And I think there's some evidence that people who are descendants of Ukrainians who suffered from Holodomor, which was a man-made famine in 1930s, and some consider it a genocide, those people suffer more now because they are reliving the same experience of Russian Soviet imperialism. So I think understanding this, it might sound very theoretical, but I think understanding these broader discussions and broader histories, I think it's helpful to inform the action. I think that was missing both in humanitarian action, but I think it just generally in just production of academic knowledge.
It's a lovely answer, because you know it's a lot of these ideas do feel very academic, and yet if you have a theoretical underpinning, then when you're out in the world working with other people, it does often reveal very, very specific, you know, intergenerational trauma and specific mental health problems as a result of you know, perhaps, or that shows us the need for that conversation about neo-colonialism. Phil, I want to come to you and then to Elias. You talked about this very specific issue of empowering local people access to funds. It is a very common in maybe every humanitarian crisis in the world. International organizations with access to governments and government funding that are wealthy have, you know, they have the fundraising capacity, they have the money, handing over to power to small organizations that may disagree with them about the best way to do the response is very complicated. How do we address this specifically in Ukraine? What needs to be done?
That's a massive question. I think probably I shouldn't answer it really by its definition, but I'll do my best. I guess if I step back a little further, I would just say there isn't a single definition of humanitarianism, and for us to say that our humanitarianism, like from the West and big donor governments, is the humanitarianism is already, I think, probably us getting it wrong. We can trace roots of this current version that tends to be the textbook one back like to any number of sources, but I really like what the Quakers were doing in the Irish potato famine response with regard to like mutual aid, no assistance without advocacy, and pushing back against the causes of that and land rights and so on. But I guess, you know, some of the key barriers are language and their access to funding, but even further than that, it's about prioritization, and we're still sort of creating these forms which have an implicit idea about our priorities and how are you going to carry them out, and that needs to be flipped. Anyway, thank you. Back to you.
And having any of those conversations, it is not, I think, immediately obvious, or at least it wasn't immediately obvious to me as a young doctor in a humanitarian crisis. You think, but I've had all this training. I'm with a massive organization. We have a budget of 100 million euros a year to run our field hospital. we were a machine, we were a juggernaut, we steamed in. And we stripped healthcare workers out of local facilities. We inflated salaries. We took drivers. Some of our drivers should have been working in local healthcare facilities. There were all kinds of aspects of the situation that we were unaware of, and ended up as a result being, complicit in government strategies to abuse people that we were unaware of, and I was unaware of for years afterwards. Which is why I'm such a big fan of this master's in humanitarian training. Elias, can I come to you specifically about the business of bringing in that expertise? What are your conversations like with the doctors on the ground, with the healthcare workers on the ground, and how do those trainings go? What are the delicacies? What are the challenges with it?
Okay, big discussion, I will say this one, and very, very interesting.
We're going to ask big questions. We can't do small questions. We've got to do big questions. That's exactly. And you can always say, look, if you want to know more, come and do the masters. That's fine.
Exactly. So I will say that I want to make a comment about the funding issue, and the funding issue, I will say that for me, there is the priorities of donors and the way that the donor system is working is directed to the big organizations. It's issues of trust, different other issues of accountability, of bureaucracy, of capacity to deal with a huge amount of workers that simply they fill reports and things like that. Is I will say the main step that leave local organizations around the world very competent sometimes, with very competent people, that they don't have access to this big machine. And this should change. And I will say, I will leave that here. Okay, it's a discussion not for a webinar, but maybe for a master. Okay, so let's say that to say that the donor system need to change. This is the first thing. Going back to the health workers, I will say that is sometimes something is part of our way of thinking. Okay, so let's say I remember many years ago in MSF, I was the first country director that put a national Swazi person in a position of field manager. Okay, so let's say that, and this period was quite revolutionary, but was a very competent person. So let's say that there was no discussion about things like that. But we need to build the competence. And I will say that Ukraine had a difference with other countries. We had already very competent people. The person that after a few months that I was there become a field manager, basically he was already director in a small factory before the war. So let's say he have more managerial experience than all the humanitarians that I have seen in my life. Okay, so, and in this way, you just need to understand the humanitarian world and to understand the way of working the system, basically. And after that can be really, is already a really great manager. Okay, so let's say there are, and not only that, technical people, okay, let's say persons, monitoring evaluation specialists and things like that. Okay, so let's say we can find, okay, so sometimes it's important this approach to exist in the organization. For example, many times the organizations, they advertise only internationally the expatriate positions. We advertise also inside Ukraine the expatriate positions, and in this way we had candidates from inside Ukraine for these positions. Okay, so let's say I would say is mentality that needs changing, and I can see that it's changing by leading different organizations. Okay, so and at the same time, the whole system of aid need to move more in a more, let's say, less colonial approaches.
That is fantastic. So between all of our panelists, you have emphasized humility, local involvement, access to funding, and of course, and the value of lived experience on the ground, whether it is from people who live with disabilities, or whether it is people who live in the country, or an experience of historical experience of trauma in Ukraine, and a relationship to Russia as a result. So Maria, then, can you speak to the masters with regard to that? Because what we're saying is, come study at UCL, we'll tell you how to do all this stuff, but we're also saying you shouldn't be the ones doing it, going, of course, we would love people from affected populations, affected persons to come and do the masters as well. But if you are someone who says, look, I've got something to offer, I really want to go out in the world and help people who are strangers, maybe not from my country, not situations I work in, what is the role for expats and why should people do the masters?
I think it's a really good question. I was just reflecting on what everyone said, and I think, you know, a lot of these points, you know, Phil talked, you know, Elias, you talked about capacity building, again, hugely important. You know, we shouldn't assume, of course, local people are the experts, but you know, we don't assume they're experts in that particular area. They may never have seen these, you know, events. God forbid, you know, hopefully they haven't seen many of these events. You know, I was thinking about some of the things Anna talked about, and I think Yulia, you touched upon this. You know, if I had £1 for every time someone said about the cluster, you know, the UN coordination mechanism itself is a huge bureaucratic and, you know, difficult to negotiate and navigate, and isn't necessarily meant to be for local organizations, but you do need to know and understand how to navigate that. It may not be the perfect solution. It's what we've got to work with at the moment, and, you know, can be utilized effectively once it gets going. And that's, I guess, the age juggernaut bit. Once it gets going, it has, you know, the points of principle are there. You know, let's not forget the sort of underpinnings of a lot of humanitarian work. I mean, first and foremost, it's about standing in solidarity. You know, that's, you know, it's not meant to be standing above, it's standing in solidarity with. And I think that's, you know, it's an expression that these are overwhelming events. That's the definition of a humanitarian crisis. They are overwhelming events. And so you want to be able to provide that solidarity, to provide that support, to build that capacity. You know, I also think about, you know, is it, you know, how many local organizations, Anna, were working on disability or older adults issues at the beginning of the crisis? Every single juggernaut agency wanted to work with those local organizations. And that was a huge and overwhelming you know, a event for them, you know, to actually suddenly have all these people coming and you know, doing their due diligence and offering, you know, have you got the capacity to absorb whatever amounts of money, you know, so you know, the system itself is kind of set to as you rightly say, Elias, to have these bigger funding, bigger rents, you sort of need to know the system to be able to work with it. So I think, you know, for anyone doing any, you know, really important, we've touched upon history. I think the importance of history and local history is local lived experience. You know, that's something you really need to build on and learn. And I think, you know, Yulia, you make a really invaluable point about, you know, it's not one colonizer, there are many colonizers and many different contexts of that, and that's something to understand. You know, what do we mean by building capacity? You know, is it training people? Is it giving people, you know, specific sets of skills about managing finance or writing log frames, or you know, or is it the capacity to actually deal with what is a hugely overwhelming and bureaucratic system? You know, I think, you know, if we take a lesson from Ukraine, you know, it is that that there were mistakes in the beginning, or at least things that perhaps should have been done differently and better. But maybe if people had more awareness and capacity in the first place, then those could have been negotiated in a slightly different way. And that's how I see humanitarianism in the round, is that it's a process of solidarity and negotiating. You know, we have to talk about these issues. We keep saying they're big issues. They're huge, but we do need to talk about them, and we do need to be able to have a conversation about how to start to influence and change the things that we know and are not new. You know, the poaching of staff, Phil, I mean, I think that was happening. You know, we all heard the stories of doctors driving cars, you know, or becoming ambulance, you know, these things are not new, but they, you know, the fact they're still happening is the problem, right? And that's what we need to really be, you know, the next generation of humanitarians need to be doing that differently.
Brilliant. Thank you, Maria. So we've got a few minutes left, and I'd love to hear from everyone again. So we have a question here saying, do you see crises of a similar nature on the horizon? Can the humanitarian sector have any influence avoiding, mitigating disasters like this in the future? That leads me to where I wanted to get to. If everyone can speak to it quickly, I'd love to know what each of the panelists wish they'd learned when they started working wish they'd known when they started working in the humanitarian sector. What was the thing that you felt that you were lacking? And also, what was the thing that you felt like your colleagues were lacking, particularly your international colleagues? Is there some bit of knowledge? And I'm happy to go first. I wish that I had understood that governments wanted to manipulate aid to harm people, and that it was possible to use even a good field hospital to do a huge amount of damage to people. And I wish that my colleagues had, what do I wish of well, I wish that we had known more about listening to our local staff and our national staff, and understood that their not just their knowledge was valuable, but you talked about leadership roles, about the value of putting people in different positions, and we were not good at that. So all the medical training was was very much less important than I thought it was. Anna, can we go in this same order again? Do you mind if I start with you?
Yeah, of course. I think what I wish that I knew is, it's a bit less of a systemic issue, is just kind of the personal toll that this work takes if you're not taking care of yourself through it. And this Ukraine was really kind of my first, I had done some emergency response work before this, but this is my first, like, working 16 hours a day, maybe more, waking up every 2 hours to check my phone because there was always a fire to fight. You know, my first really, really tough one. And I was told at the beginning by my colleagues more senior than me, you know, it's a marathon, not a sprint. Take care of yourself. Make sure you're eating, make sure you're sleeping. Otherwise, you're not going to be helping anybody. And it took me a while to figure that out. I ran myself ragged, and so did a lot of my Ukrainian colleagues, because they had also never worked in an emergency or disaster. They didn't want to work in this sector. They wanted to do something else, and then war came to their country. And I think we all, because it was so close to home, we were helping disabled Ukrainians, and we were almost all either disabled or Ukrainian. It felt like, well, if I don't help this person, if I don't stay online another hour coordinating more evacuations, you know, who will? These people are going to be left behind. And so it is a lot of pressure. But you do have to take care of yourself, push your colleagues to take a day off, because that's necessary to keep the work going. And to be in solidarity, as Maria said, you know, you're not just helping people, you're not saving people, you're being in solidarity with them, because this could be you, this could be anyone. So taking care of yourself is really important.
Amazing. That is, and I think everyone is nodding along. Amazing advice. If you get one thing from this webinar, hopefully you've listened to that. Yulia, can I come to you next? What do you wish you'd learned? What do you wish you'd known at the beginning?
Thank you. I obviously agree with Anna, similar experience, especially of the first couple of months of the war. But I think it's sort of connected to the points I've made before, that I wish I knew the value attached to the local organizations, grassroots movements, and local volunteers, because when I graduated from law school and wanted to pursue humanitarian career in Ukraine, I think the ultimate dream for most of the recent graduates was to work with the UN and like with the big international organization. And I think it's obviously it does a lot of good work, but I think the work of grassroots organizations, the local Ukrainian organization in this case, it's not less important. It is also valuable, and it potentially can actually bring, in certain cases, more impact and more effect on the population, and just generally connected to this thing is just also attaching value to local knowledge and your own knowledge, because obviously I pursued education in Western universities, etc. But I think I didn't realize necessarily or valued enough just regional knowledge and language knowledge. So, for example, when I was stationed in Bosnia and Herzegovina, initially I was thinking that potentially I wanted to be somewhere else in Syria or somewhere in Sudan. But I think it actually worked out for the best in terms of, because I did understand the context more, I spoke the language. So I think just also being aware of your strengths and not just, I don't know, pursuing necessarily the career with the UN organization. I think I wish I knew that when I started.
Amazing. That's, and especially the training, if you have a kind of very particular professional technical qualification like you do, it is easy to get to discount other kinds of training. And I think lots of necessarily the providers of technical goods and services get wrapped up into that. Phil, what did you wish you'd known at the start?
it's something that I still wish I knew. So I thought that I felt all four humanitarian principles were equally critical at the start. Humanity, alleviating humanitarian suffering where we find it. Okay, that's pretty clear. Impartiality, doing so without respect to any protected characteristics and on the basis of need alone. Okay, I'm still good with that. Independence, not being swayed by foreign policy. Okay, I'm still good with that. But neutrality, not taking sides in an argument or conflict, I'm not sure how I feel about that anymore. I mean, it's crucial in terms of accessing different locations so that you're not seen as affiliated with one side or another. And if you're working internationally, it's super important. But should we be as internationals imposing that on nationals close to the front line who are suffering direct harm and who aren't going to be doing cross-line response? Are we not writing them off completely by asking them to hold a neutral position when it's really hard, if not impossible to do so? And I still haven't figured out what my view on neutrality is, but thanks.
And that is maybe part of the fascination of careers in humanitarian work. They are exhausting and can be very dangerous, degrading, difficult, and all sorts of things. But the sheer complexity and challenge of these issues, constantly presenting you with things that you still don't know, really is. It's hard to think of a positive word in these situations, but rewarding, fascinating, engaging, deeply worthwhile to pose those questions. Thank you, Phil. Elias, can we come to you?
I can say that 20 years ago that I started moving around.
No, never to it. Surely not 20 years.
I can say that and still have this first question. I will say that I will think that the approach that we know everything and we are going there to save everybody, I would prefer not to have it. Okay, so, and I would prefer to be, let's say, trained or someone to have teach me to be there to understand more. Okay, so, and to collaborate more, because in the end of the day, all these years, I learned. Okay, so, and I learned much more. Okay, so from the collaboration that I had with different people. And the second thing that I will say is, in my area, in the health area, I will say death and the difference in the value of life. And I will say that this, I will wish to know a little bit more when I was starting.
What an amazing note to end on. Maria, between those answers, I feel like we've touched on so many things that the masters would help with. Can you sum up and just remind everyone that this will be in the masters? People have asked, we've got a question in about sort of who the course is for. Is it just going to be short-term humanitarianism, things like medical intervention, or is it going to be long-term approaches? Can you just round us up as to what will be there? Who's it for?
I think that we've put a link to the course in the chat, and hopefully in the prospectus there is some more detail. But it's all of those things, right? I think, we see often it's so tempting, in every emergency to think it's going to be just short. It rarely is. And we often go in, with our immediate responses, but they do have to change. Like many things, these are not static, fixed, they change over time. The politics can change, the interventions change, certainly the funding and donor and media attention changes over time, and that can impact massively how we respond. And I think, I was trying to think what I would wanted to learn in the beginning, and it's probably that where you are 1 month, 3 months, 6 months is often really different, and you can go back, as I have, to the populations in some countries over time and have met the same people that I met a decade ago in a very different context, and that's been really great. It's you know, it means you hear about their lives, and that's the important bit, right? It's about people's lives. These are people, you know, in the end, these are people that we're talking about, and what, you know, what their lives and the, you know, what's happening in their lives. And I think that's, you know, what I would like to us to get as a group, you know, in this module in the program, is that we just have that time to reflect and think. So we have a sets of practical skills, but we also have the opportunity, as I said at the beginning, to discuss these issues. Some of them are contentious, some of them are awkward, some of them are difficult. Phil, I think you touched upon, you know, the thorny issue of neutrality. You know, these are really challenging and sometimes, you know, sometimes confrontational, but it's good to have a safe space and really try and tease them out. You know, I think that those, I came at this as I came to this as an anthropologist, and having that sort of, you know, I was quite surprised at some of the lack of humility and the people assuming they knew the answers and that they didn't need to learn the language, or they didn't need to have, and I was quite surprised by that, and maybe continue to be. So I guess, you know, I hope that we learn that just to have the questions. What are the questions we need to ask to make sure that we don't make those mistakes again? I'm sure we will be in 20 years having a conversation about making the same mistakes, but at least let's try and ask the right questions in the first place.
Can I say a huge thank you? Maria, you mentioned that you're an anthropologist. I always feel like the anthropologist saved my life as a medic. Amazingly valuable and so useful to have that running through the masters as well. Can I say thank you enormously to all the panelists? You are all tremendously busy, but hearing your wisdom and your experiences and the emphasis you bring could not have been more valuable. And can I say thank you very much to everyone who has joined us today. I could not be more pleased that so many people have taken a big chunk out of their Monday afternoon to talk about this issue, to take an interest in humanitarianism. Despite all its flaws, it is still the most worthwhile way of engaging with the world. Is incredibly valuable for all the frustrations of this work. I think the entire panel would agree that if the value of it, you know, the point of our lives is to entwine them with other people, and humanitarianism done right is the very greatest way of doing that. So thank you all very much indeed. Thank you for coming, and check out the masters. It really will be a fantastic course.